So my name is Althea and I am Head of Community Participation at WIPS. That in itself is an entirely new role for the hospital. So I work for a busy local district hospital. And as you know, a hospital's role was really to fix people, repair people, and then send them on their way. This whole remit around anchor is asking the hospital to do something completely different to what it was established to do. And that's taken some time for each of us to understand what that means for us in our roles and to understand how we deliver that. And I think it's fair to say that for me and my hospital, I'm talking about an anchor organisation and becoming a credible anchor organisation in the local area, whereas the hospital has been in Opal 4, which means it's been extraordinarily busy um, for ages. So normally when there's a crisis, you'll go into this level, but it's starting to become the norm. So I also have to bear that in mind that I'm speaking about and asking people to be positive and proactive about being an anchor organization. But it's also important to recognize that many people in the hospital are really challenged just doing their regular day to day. And I think that's important to set the context. Um, that said, for me, historically, I come from the community voluntary sector background, and engagement means something completely different to me than it does to people traditionally in the NHS. So in the NHS, from my understanding, engagement tends to mean telling somebody, telling something. It's about telling you what the NHS is going to do, when it's going to do it, how it's going to do it. It's not about a dialogue. An engagement for me is about a dialogue. It's about understanding who you're working with, what their motivations are, what their aspirations are. And so that's quite different to the broadcasting approach that the NHS tends to have, in my experience. So with that in mind, with engagement to me being about a dialogue, being about building relationship and partnership, when I came in to this role, I was already involved in supporting the hospital to set up a sort of a community forum. And they set up the first version of the community forum, which the hospital wanted to control, not only control the agenda, but also the membership. That didn't work. And then there was a second version of that, and that didn't work. And now we're at the Community Health Forum. Why the Community Health Forum is different and why it's working is the first thing we established was who is not in the room. Who are we not hearing from? We're talking about health inequalities, we're talking about specific challenges, but are we listening to those people? So one of the first things of my role was to directly go out and engage with those people, those communities that we say we're not hearing from, and to make them feel welcome and able to participate in the Community Health Forum. The second thing that made the Community Health Forum successful is that it has an independent chair. So a local resident is paid some money to be the chair, and they are independent. And that's made a lot of difference in terms of, as chair, you are afforded some status, position, influence that you may not have if you are just an ordinary member of the forum. So we're trying to strengthen that role to enable, because the chair, Zach Mohammed, he's young, he is working full time, and this is an addition to his work. And I really recognize that. So I'm really aware that I also need to build his support team within the Community Health Forum. Um, I think as well as having the independent chair, it's really important that when we engage inclusively. And what that means for me is that we try and reduce as many barriers as we can. So, I've spent a lot of time, and colleagues have spent a lot of time out in the community. So, not expecting people to come to us, but going to the community centres, going to the libraries. The libraries are now a really good site of engagement for us in Waltham Forest and Redbridge, because it's very difficult to access council services without going through the library. So it's actually now become quite a useful site of engagement. And we also use the hospital. We speak to people in and out of the hospital, just with simple questions, simple engagement, but also we make sure that we feed back. So there's a feedback loop, because what people will tend to say is that we give our opinion and then nothing happens. So it's really important that whatever information we get, how we use it, if we use it, we report back. So the Community Health Forum really is a vehicle of engagement that is being used to bridge that gap between the hospital and the community. And it allows the hospital to speak with the community, and it allows the community to speak with the hospital. That is the intention of the Community Health Forum. Um, I have to say, it's had its challenges. So it's, if I do the challenges and then I'll do the successes. The challenges have been resource. We have access stop-start funding, which meant that the investment in the Community Health Forum wasn't consistent, and that impacted on the success of the Community Health Forum. We are part of the Community Health Forum, is an intricate part of the hospital redevelopment. That means when the redevelopment funding is withheld or slowed, so is the funding to the Community Health Forum. And community engagement isn't something you can stop and start. It has to be something that is invested in and continually resourced to allow it to grow and evolve. So that's been a challenge, managing the government protocol for the new hospitals programme with regards to investment, and maintaining and building relationships on the ground and keeping people interested. That has been a challenge. Another challenge has been for the forum is putting the role of an anchor organisation and embedding that into the work of the hospital. So as I've said, the hospital has been extremely busy, extraordinarily so. And therefore putting the agenda of being an anchor organisation has been challenging at times. What the approach to that we adopted was to really go for the senior leadership team. So to really build relationships with the director of HR, the lead for EDI, the lead for health equalities, just to make sure it's in their psyche that anchor is important. And I have to say that has brought good fruit. So we do have a good understanding of what an anchor is now, and we do have good support from the senior leadership team, but that took time to build those relationships, and to get that level of understanding took time and does take time. And embedding the role of an anchor, and for people to see how their role impacts on being an anchor organisation, is something that requires continual work. Those would be the main challenges. What I would say the successes are, we have been able to bring a really diverse group of people who wouldn't normally meet each other or communicate with each other together. And our approach isn't that you have to come to a meeting. is that we will have community conversations. So we will have a question, a key question, maybe about carers, maybe about outpatients, maybe about the hospital redevelopment, and we ask people to go and discuss that. And it becomes like a cascade, like a waterfall effect. So we want people to be having conversations with their neighbours, and that all of that information come back into the forum. And then we collate that and escalate it appropriately, and we communicate exactly what we've done. Oh, there's the hounds. Um, we communicate exactly what we've done back to the group, and also we get clarity. We really try not to do that fudging stuff, if you know what I mean. We really want to build our relationships with honesty and integrity, and when we don't know, we're really upfront to say that we don't know. But this is definitely a work in progress. It has been challenging, but it is worth it. It is worth it. We now have an initiative called Recruit Local, where we are running recruitment campaigns to recruit local people into local jobs at the hospital, and some of our contractors have. That wouldn't have happened without this approach. So we've got community voluntary sector organisations involved. We've got patients and public involved. We've got local community residents involved, and that dynamic, that group is so rich. It I find it really, really exciting. And it is about identifying a new way of working. And it means a new way of working for me. I'm somebody that's worked in engagement for longer than I care to remember, but I still have to adapt. I still have to be flexible, and I still have to work with what I have available to me. And it's meant that I've had to be really creative and really focus on building quality relationships, because of the lack of funding. You really have to learn to work together. And I really like the title of this conversation. It's not about doing things to people. It's about asking people what they want, what they need, and then seeing how best you can meet that need. And I think I'll leave it there and wait for any questions. But yeah, it's really important that when you're doing engagement, you go with a clean slate. Just all you need is your integrity and your honesty and your professionalism, and then receive what you get from the communities that you're speaking to.